Hello friends, today we are going to discuss about post-traumatic stress disorder, commonly called as PTSD. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place the disclaimer. The disclaimer is, this presentation is for academic and training purpose only. This is not a substitute for professional clinical opinion. For professional clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I'm going to discuss about how to diagnose post-traumatic stress disorder using DSM-5. And this video is targeted for psychiatrists, various other doctors, nurses, psychologists, social workers, students in this various fraternity, patients, and their family members. Let's discuss about the diagnostic criteria for post-traumatic stress disorder using DSM-5. According to DSM-5, there are 8 dimensions have been placed under post-traumatic stress disorder diagnosis. Those 8 are traumatic event, re-experiencing the trauma, avoidance of the cue, alteration in mood and cognition, arousal and reactivity, duration more than 1 month, dysfunction, and not because of substance use and drug or medical conditions. These are the various 8 criteria have been placed. But however, regarding A, traumatic event, must 1 symptom is required. With regard to re-experiencing of the trauma, at least 1 symptom is required. With regard to avoidance of the cue, at least 1 symptom is required. That is, 1 symptom is required from A, B, C. Along with that, alteration in mood and cognition, 2 symptoms are required. Along with arousal and reactivity, 2 symptoms is required. That means the number of symptoms are required is 7. Along with duration being 1 month, along with requirement of dysfunction, and it should not be because of substance use and drugs or medical conditions. Let's discuss each one of these criteria. Criteria A, that is trauma, at least 1 is required. That means traumatic event is a must for the diagnosis of PTSD. The trauma should be either direct exposure or witnessing the trauma. Along with that, if a person learns that the relative or a close friend was exposed to trauma, that is also a traumatic event. Indirect exposure to aversive details of the trauma, usually in the course of professional duties, such as first responders, medics, doctors, nurses, who are indirectly exposed to trauma by looking at the dead bodies, listening to the narration. For them also PTSD diagnosis is allowed. That means first responders, if they are exposed indirectly for the traumatic event, can be PTSD diagnosis is entertained. However, the virtual exposure is excluded. For example, if somebody is watching a movie or else a real event on television or else on the internet, and he develops some symptoms because of exposure virtually, PTSD diagnosis is not entertained. That means it has to be direct exposure or witnessing the trauma in person is essential for the diagnosis of PTSD, except in first responder and medics, it is allowed. Moving to the criteria B, that is intrusion symptoms, at least 1 symptom is required. Here, the re-experiencing of the symptoms. What are those symptoms? Unwanted recurrent upsetting memories, nightmares, or else flashbacks, emotional distress after exposure to traumatic reminders, physical reactivity after exposure to traumatic reminders. Any of these 1 symptom is required for intrusion symptoms under criteria B. Moving to criteria C, avoidance. At least 1 is required. That is, trauma-related thoughts or feelings he is trying to avoid. That is must, or else trauma-related external reminders, at least 1 is required. That means either one of them is required under criteria C. Moving to criteria D, negative alteration in cognition and mood. At least 2 symptoms are required. These are following: inability to recall the key features of the trauma. That is common in PTSD. The person forgets the key traumatic event and the symptoms revolving and also the events revolving the trauma is forgotten. Negative perception of self and others, exaggerated blame of self and others for causing the trauma, negative affect, decreased interest in activities, feeling isolated, difficulty in experiencing positive affects. Any of these two symptoms is required under criteria D. Moving to criteria E, alteration in arousal and reactivity, 2 is required. That is, with regard to mood, irritability and or aggression, risky or destructive behavior, hypervigilance, increased startle reaction, difficulty in concentration, and difficulty in sleeping. At least 2 is required in criteria E. Moving to criteria F, the duration. That is, more than 1 month is a must. Moving to criteria G, functional significance is required. That means the symptom need to cause dysfunction with regard to social, occupational, and biological function is a must. And criteria H, exclusion criteria. That means PTSD symptom should not be secondary to medication or substance use or because of other illness. That is very essential. And there are two specifications are there, that is core specifiers. One is with the dissociative specification or else delayed specification. Dissociative specification means a person with PTSD having depersonalization and derealization dissociative symptoms. If they are there, that means he may have poor prognosis. That means course may be chronic. With regard to delayed specification, it is well known by research. If a person develops PTSD symptoms after 5 months after the traumatic event, that means the course will be chronic and it will be difficult to treat. That means delayed specification or else dissociative specification will give you a hint regarding the course and prognosis of PTSD. However, you need to differentiate between PTSD and grief. For any trauma or any stressor or any grief, it will be considered as a response to a loss. With regard to any trauma or any loss, the grief is the common response. That means invariably in COVID, because of the loss, there will be a grief. And invariably, studies have shown that 90% of the grief will resolve on its own. Doesn't require much help. The family members, friends, and society will be able to support the person who is under grief. But however, 10% will develop complicated grief which requires professional help. But please remember, do not confuse PTSD with grief. Grief is a response for any loss. And invariably grief, patients will have either maybe complete denial, shock, maybe anger, there will be bargaining, there will be depression, and maybe acceptance. So these are the various symptoms which can be seen in grief. Whereas in PTSD, they are classical. There will be a traumatic event, there will be increased arousal, there will be avoidance, there will be recapitulating the whole event, and they will be reliving the whole event. That is classical in PTSD. Hence, you need to differentiate between PTSD and grief. Do not call every grief as a PTSD, but unfortunately traumatic grief sometimes may overlap with PTSD, but it is very easy to differentiate between PTSD and grief. One need to differentiate between PTSD and remembering trauma. Whenever there is a trauma and grief is associated, invariably people will remember the traumatic event many times, but it should not be confused with PTSD. Here, there are the differentiating points. In PTSD, reliving is classical. That means person will go through the traumatic event again. Here and now, he will have increased arousal symptoms, panic attacks, he will have tremors, sweating. At the same time, he will have increased vigilance, hyperventilation, active avoidance. He will not answer certain questions. He will say, I will not be able to remember. He becomes irritable. Sometimes hypervigilance will be classical here. And there will be classical dysfunction with regard to social, occupational, and biological function. And PTSD is a continuous illness. Whereas remembering trauma is episodic and he is remembering it. It is occurred in the past. He remembers it. More of depressive features, more of crying will be there. There will be no avoidance. And invariably hypervigilance will be absent and it may be normal. Dysfunction will be absent here. And it is episodic and transient. Remembering trauma is classical with regard to anniversary reaction. Hence, you need to differentiate and you need to ask for dysfunction, continuity, hypervigilance, avoidance is classical for PTSD. At the same time, one need to differentiate between PTSD and borderline personality disorder because both of them share some of the symptoms. Especially in borderline personality disorder, the onset will not be very precise, impulsivity will be very high, emotional instability, emptiness of the mood, self concept poor formation will be seen in borderline personality disorder, stormy relationship, unstable relationship, rejection fear, blaming others. No or few long lasting relationships are common in borderline PD. At the same time, please remember borderline PDs have multiple DSH attempts, deliberate self harm are common. Further, one need to differentiate between PTSD and other stress disorders like acute stress reaction or disorder or else adjustment disorder. In both the situation, it is the symptom severity, duration plays a very essential role. With regard to acute stress reaction and disorder less than 1 month, most of them will resolve and it will be considered as acute stress reaction. If it presents for more than 1 month and the symptom numbers are there, that means it will be PTSD. That means acute stress reaction will be converted to PTSD after 1 month. Whereas adjustment disorder will be short lived, lived to the duration of stress. If the person has 7 symptoms with regard to PTSD more than 1 month, it will be considered as PTSD. Hence, to differentiate between PTSD and other disorders, it is the duration of more than 1 month and symptom severity and quality plays a very essential role. To conclude, my dear friends, PTSD is present in all culture, across various countries, across the continent, and it can be easily diagnosed using DSM-5. PTSD is a biological construct with severe traumatic event having a direct impact on the brain and also on the endocrine system and immune system. Early diagnosis and the treatment is the only way to address the PTSD. Do not forget to address comorbidity, differentiating with various other disorders. Thank you very much for your valuable time. Stay safe.